Hello, everyone. Welcome back. This is another great webinar for the Direct Specialty Care Alliance. My name is Diana Girnita. I'm one of the founders of Direct Specialty Care Alliance. And today I have the pleasure and the honor to have here another colleague of us, Dr. Abisogun. She's a triple board certified endocrinologist. She's a physician coach and entrepreneur. She owns and operates Shoreline Endocrinology. This is, as far as I know, the first direct specialty care endocrinology practice in Savannah, Georgia. Abi is from Liberia, West Africa, and she has quite an impressive life story. She immigrated from there in the US because of the devastating civil war. She grew up in the suburbs of Minneapolis in Minnesota, and then she moved on the East Coast. She completed pre-med studies at Loyola University in Baltimore, and then she spent a year to do research at NIH, followed by her medical school that is called Reuters Robert Wood Johnson Medical School in New Jersey. Dr. Abi completed her internal medicine residency at Brown University, and that was followed by a fellowship training at Duke University. Dr. Abi, thank you for taking my call, and thank you for accepting the invitation. We are very honored to learn from your story.
Thank you so much, Dr. Girnita. This is an honor, truly. I was so excited to join you today.
So we have to ask you, where did you hear about direct care practices or direct care movement?
You know, when I first decided to open a cash-based practice, I didn't know much about the direct care movement at all. In fact, I didn't even know there were physicians in my own community who were doing it. I just had this idea that, man, I'm tired of all the administrative layers involved in private practice, and it just has to be a way that's simpler. So I imagined that if I didn't deal with insurance, that I could just reduce all the costs, the overhead for staffing. And I didn't want a manager. I didn't want an office manager. I didn't want to deal with it anymore. I wanted to just deal with the patients. So I started to plan, and it was actually a patient of mine who was an RN who said, "Hey, you should speak to Dr. So-and-so. She has a practice that's cash based, and she's right here, and she's wonderful. I'm sure she would be glad to meet you." And she gave me the phone number of who I consider a mentor in direct care. Her name is Dr. Pam Gaudry. She gave me her number, and I reached out, and she was immediately so excited to talk to me about direct care, and just sort of introduced me to this whole new world. So that's how I kind of started.
When did you start your practice?
I opened up November 15th, actually 2021. So I am approaching 2 years in now. So
congratulations.
Yes,
that's amazing.
Thank you.
You mentioned about administrative burdens, but what was the thing that kind of connected you with this idea of doing a cash pay practice? Because usually this is not something that you encounter during your fellowship or your internal medicine training. And I do see that you have been in, very respected institution, but I do believe that nobody mentioned that there. So what attracted you mostly to this model where you interact directly with patients?
I think the thing that attracted me the most was the time. The time factor was what was missing for me in the conventional model of practice. I just always felt like I was short on time, and I would try to squeeze in as much as I could for, to try to benefit the patient at my own detriment and that of my family. I have children, and so I would pay for it at home later when I was trying to catch up on all the administrative work, because when I'm with the patient, when I was still in the conventional model, I would try to use every minute to address their concerns and to listen. And I found that I wasn't spending time during the day as much doing the charting and the ordering and the reviewing of tests. I would take that home in order to give the patient as much time as possible, and it still wasn't enough. So that was one of the main things that attracted me to direct care. Was when I spoke to Dr. Gaudry, who was the first real life DPC doctor I had spoken to, and asked how much time she spent with her patients, and she said, "Oh, an hour." I was shocked. I was like,
Correct.
I've never even dreamed that was possible. So time was a big thing for me.
Good. And when you started to put things together for your new practice, what do you think was the biggest challenge that you have?
I would say the biggest challenge, honestly, was having to basically cultivate a new mindset, a new perspective when it comes to the doctor-patient relationship. I think we are, at least in the US medical schooling and training, conditioned to sort of actively put away thoughts about the business side of medicine and to just focus on the patient care. But in reality, when we come out into practice after training, we're faced with so much business that we have not been properly educated and trained on. And it takes away from just focusing on the patient care. So it sounds nice, but it's not realistic. And
Correct.
so, for me, I had to shift the way that I thought about this interaction with patients. It is a transaction in some regards. Yes, I am absolutely devoted to my patients and I want them to do well. And that's my number one priority, is to give them the time and attention they need. But in order for me to actually do that, I have to generate revenue and I have to have a sustainable and profitable practice, because the bills have to get paid. Otherwise, I'm not going to be able to help them. So that reality was something I had to, face and really accept when starting, because there was some guilt there. Naturally, I felt like, oh man, I'm charging people money. That was the first time I was involved in the transaction directly. Prior to that, there was always front staff or office manager. Someone else was collecting the money, right? And so it was very different. In that shift, if one does not really make it in an effective way, it can actually be a detriment, and it can actually slow the growth of a direct care practice and keep you from actually staying operational. You got to be able to collect the money.
I love the fact that you mentioned change the mindset, because I think this is the biggest hurdle for all the physicians that I have met, to change that kind of mindset. What helped you to change the mindset? What kind of things have you done to help you change the mindset? Did you have to take an MBA course to think business, or did you have to have a coach, or what changed your mindset? What do you think?
Really, it came from within. It came from a lot of self-reflection and really thinking about, okay, why am I doing this in the first place? And because one of the main reasons was I wanted to be available for a longer, period of time to serve patients. I sat and thought about, okay, I've devoted all these years to acquiring the knowledge and getting the training and the skills. And there's so much need. I practice in Savannah, Georgia. Just diabetes alone, the need is crushing. I said, so there's so many people who need this kind of care. And you know, in like most cities in this area, it's hard to find an endocrinologist. He said, you know, I have to figure out um, a way to be able to keep helping people and not allow myself to just burn out. And if I keep going at the pace that I've been going for these first 5 years of my career, I will I will not want to practice medicine anymore. And so I have to go back to that when I'm having the feelings of guilt or doubt about the transition that I'm making. I have to go back to why I'm doing this in the first place. I'm doing this so that I can be able to serve my patients in the way that I feel they deserve. And also self preservation so that I can stay healthy and sane and able to keep doing this work. And this is just what's required. And my skills are valuable. Um, I just had to look around at other professionals. They have no problems, you know, charging for their services. Why should I have a problem? You know, so those are the things that I had to kind of reflect on and go back to and journal about and talk with my husband, who's also a physician. So I would say I had kind of a built-in coach because I would talk to him about these things as I was transitioning. He's still in the conventional model, but he was my number one supporter. So that's
Correct.
kind of how I made that shift.
That's incredible. And thank you for sharing that, because I feel like this is the biggest hurdle for most of us. We are not trained to do business, but we are also putting a stop to our mind when it comes to business. And you know, your hurdles were my hurdles, your guilt was my guilt, and I'm sure it was the guilt of everybody. And I
Yeah,
had the same kind of self-reflection where I had to sit down to understand what am I doing and why am I doing those things. And like you said, it's very important to look around and see other professionals that,
yeah,
you know, they don't feel ashamed that they charge for their knowledge and for their services. But the other thing that was kind of a big step for me was, how do I decide to price my services? So my question is,
yes.
how did you decide? How did you decide what is the price of your services? Because as you know, there is not a comparison that you can make for specialists, okay? For direct
Yes.
primary care, now a
Hmm.
lot of people that they join that kind of practice, they have an idea where to set their practices. You know, they have an idea that if they set up a membership to a certain level, that will be a viable model for them. But for specialists, it's different. So my
Yes.
question is, how did you decide on your price for your services?
Yeah, that's a really good question. It's been a journey and it's ongoing.
Of course.
So initially, I what I did was I literally just called around. I actually had my medical assistant help me do this. Call other offices and ask, what do you charge for a cash pay patient who does not have any insurance?
Mm-hmm.
And so I collected that information and kind of made a spreadsheet. And then I reached out to other specialists because there were none in my community. I reached out to other specialists who were online because I was in all the Facebook groups, you know, reading about the topic, messaging people,
Mm-hmm.
asking whoever was willing to share. And some people, you know, of course, would have their pricing on their website. So if they share the
Correct.
website, I went through so many websites looking at their price structure. And it was fascinating because there was
Mm-hmm.
so much variation, you know,
Correct.
and thinking about the cost of living where those specialists were versus where I live. And I just kind of went also with my gut. So I took all that information together. People outside my community, people here, the DPC docs here, who I went around and met everyone and established a relationship with everybody. And I came up with the pricing somewhere in between, somewhere in between what the DPC doctors were charging in my community and what specialists in other, cities were charging. And I said, well, I will start here and see how it goes. And then I'll adjust as time goes on based on how I'm doing. And that's exactly what I've done. And I've had no regrets about it.
Excellent. Is your practice only in-person appointments? Do you offer telemedicine as well? Do you practice only in your state, outside of your state, other states?
Yes, so I am in Georgia, and currently I do both in person and virtual visits. So
Mm-hmm.
Savannah is a lot of people know about Atlanta. Um, Savannah is a good three and a half hour drive from
Mm-hmm.
Atlanta. So I do have some patients who are in Atlanta, but because of that drive, they might
Correct.
only come down and see me maybe once or twice a year, and then we do virtual visits in between. So I have patients who live in outer, further distances within Georgia who I do offer that service to. But currently, I am only licensed in Georgia, so I do telehealth mainly within the state of Georgia. I do plan to expand to at least South Carolina and maybe Florida. Those are my closest states, and I have a pretty good chunk of my practice that lives in South Carolina. So I want to offer that option to them as well. During COVID, it was easier, but with the restrictions kind of being back in place, where
Correct.
the patient is physically is where medicine's being practiced. So I do my best to abide by the rules, and I stick to Georgia for now, but my next step is South Carolina. So
Good. Now that you talk about the expansion of your area, I have to ask you, when did you start seeing that your practice was profitable?
it took me just around 3 months. So I opened in November of 2021, and it was intentional because I was nervous. I wanted to start a little bit slower, figure this
Mm-hmm.
out. I had never owned my own practice before, and so knowing that, okay, Thanksgiving is right around the corner,
Correct.
and then the next month there was
Yeah.
Christmas.
It's all about
I
holidays. Yeah.
It's the holidays. So I said, the holidays will help me break it up some. So I'll have a couple weeks in, and then I'll have a break to troubleshoot and put out the fires, and that's what I did. So by the time I had my first full month, which was January, and that happened to also be the month when I started offering lab draws in the
Mm-hmm.
office.
Mm-hmm.
Um, by the end of that month, I was pretty much, in the black, and by February, I was profitable, and I was elated, and also like, wait, is this a mistake? Is it just a fluke? But then each month after that, it was more profitable. So I said, okay, well, I guess I must be doing something right here.
Correct. Congratulations. But a lot of people that I meet, a lot of doctors that I meet, that's the question that they have. How can you sustain your
Yes.
family? And
Mm-hmm.
how can you pay the bills? How soon does it take until you become
Yes.
profitable? So it varies a lot. But as you
Yeah.
said, if you look at your business and you think about, okay, what am I doing good? What am I doing wrong? And you
Yeah.
quickly learn
Yes.
about the things that you have to troubleshoot, you will become profitable.
Mm-hmm.
How do you market your practice? I know that
I've
we all have
done,
to do that, but
yes.
what are your channels of marketing the practice?
So, a variety of ways. When I first started, I would say one of my first ways was marketing to my established patients from my former practice.
Very
And
good.
I think that's something that we should not forget. The people who already know you, Some of them will come with you, not most maybe, but some of them will clump. So it does pay to have a way of letting them know where you are now, and what you're doing. And it can be tricky because, many of us have non-compete contracts written into our contracts, and if you are staying in the same area, if you're transitioning from an employed position and opening up practice in the same area, you have to be careful. Of course, you have to consult with your lawyer, but if there's a way that you can reach those patients who know the quality of care you provide, and desire to keep seeing you, then those would be, kind of the first batch that you have of patients. So that was the case for me. And then I did a variety of advertising, like I haven't done a ton of print, but when I first started, I did do some print advertising targeted towards specific demographics. So older people who, there was a specific community I targeted that. I knew many of the residents were older and retired and still read magazines, and and so there was a magazine that I advertised in that went into every mailbox within that community. I also did Facebook, some Facebook ads. Of course, from the very onset, I made sure I had a social media presence, posting regularly, doing live videos, just sharing what I was doing and educating people about what my model was. Um, I also at some point did uh, not a commercial in the sense of being on TV, but actually just paid someone to shoot a video that was only a couple minutes long, but I was able to embed that into my website. And I should have said that was one of the first things, was having a website, having that out there and referring as many people to it as I could. I also did some digital media advertising, where I worked with a healthcare solutions team with one of the local news stations. I wasn't on the news per se, but what I did was I worked with them to establish like a 3-month campaign where they put up digital ads that would pop up with keyword searches. Like if someone was searching diabetes or endocrinology in my area in specific zip codes, then my ad would pop up showing them like, hey, I'm here, and you can click here and go to my website and read about what I offer. And so that I did a 3-month campaign, and that was very effective. So with each thing, what I would just do was, okay, let me see how many new patients coming in my door would it take to pay for this advertisement. And if I was able to achieve that, then that told me, yeah, I'm getting somewhere. So it's worth the investment. And I felt like with each thing I did, there was this cumulative effect, and it just kind of was snowballing. More and more people were hearing, and word of mouth was very big in my community. So people would come and they would tell their coworkers, their neighbors, and tell them, "Oh, you should go too." So word of mouth was huge, and so it was so many different things working together. But I think the right answer is do as many things as you can up front, and then reassess and see what is effective, what maybe isn't effective. So I'm not going to, spend too many dollars there. But if it looks like it's working, it's worth it to invest and keep doing it because it will pay off sooner. So that's what I would say about marketing and advertising.
Great advice. Is your practice a fee for service, or do you offer a membership model?
That's a great question. That was another thing that I had to figure out, that there was no clear answer anywhere, which was different than for direct primary care. You know, as a specialist, you do have to really think about that.
Correct.
Thinking about your patient, you know, demographic and like the conditions you treat and the chronicity of those conditions. For me, I knew I needed to offer both. I did not want to have a system where everyone was compelled to join as a member,
Mm-hmm.
because you know, I sort of will do primary care for specific patients because it just kind of organically happens, but I don't usually practice primary care, though I'm board certified as an internist. I focus on endocrinology, which is already broad enough for me, but but because I knew I wasn't going to be offering primary care, I didn't feel like it made sense for me to require a membership of every person that walked in. So I decided, well, what I will do is offer both options, membership and fee for service. But that initial consultation visit is kind of where we may make that decision depending on the patient's needs and what I anticipate, excuse me, that they will be over time. And also, you know, the patient's budget and what they're comfortable with. We'll just start with the initial consultation and go from there. I decided that people who had chronic conditions like diabetes, like obesity, because I do a good amount of weight management, I would offer them that membership option so that they didn't have any barriers to coming in as often as they needed to for us to achieve their health goals. And that also would build in some accountability for them, and
Good.
really get them to buy in into their care. And I saw and continue to see that those people do very well, because they have skin in the game. Then I said, well, if they don't want to, I'm not going to force them. That's going
Correct.
to be up to them. And then people who had conditions that didn't require as frequent, you know, visits, they could just pay per service. So, you know, if it's osteoporosis or primary hyperparathyroidism, or you know, uh, just general fatigue. I just want a one-time consultation because no one can tell me why I'm so tired, you know, things like that. I would, you know, say, okay, you can maybe just pay per visit and come as needed. So it's worked really nicely. I think people have appreciated having both options. And over time, I've had a good number of people who initially were only paying per visit say, hey, I want to do the membership because they see
Yeah,
the value, you know?
correct.
So, yeah.
Now, when somebody get on the door or they call and they say,
Mhm.
hey, here I am, and I'm interested to have a consultation. I have this insurance. Do you take my
Mhm.
insurance? How do you answer that question?
That's a good question.
What's your
This is
spiel?
something I had to coach my medical assistant from the get-go about this because I anticipated it would come up. And so what I did was I basically wrote a script for her, and it, you know, it pretty much was to the effect of, well, this practice is different than the conventional practice.
Mhm.
We really value time with you. It's important that the doctor spends the time necessary to really get to the root of your issue, and address your concerns. And so insurance does not necessarily cover that time, not in the capacity that it may be needed. And so we do not accept insurance. We don't bill insurance. You are welcome to check with your insurance payer about whether there are out of network benefits, whether you could submit a claim, but we do not get involved in the process. Our focus is just to help you, to spend the time with you. And so as a result, we can see anyone. We have no restrictions on whether we can see you because you have this type of insurance or that type, or no insurance. So I really coached her to, if she's the one on the phone, lean into the positive, desirable attributes of direct care, the time factor, the accessibility, also talking about our wait times not being long at all, which is rare for specialists, especially
Correct.
endocrinology and rheumatology also. Um, and I told her, really get people to see the value beyond just what insurance will cover versus not cover. And I also added a page to my website with the frequently asked questions because they would come up again and again each time
Correct.
someone would call. And so she would direct the caller to our website and say, hey, there are more questions that maybe you don't have right now that come up often. Please go check out our website. And then if there are additional questions, call me back. And she would follow up with people who were interested. And I think that was very effective. But part of the process with transitioning to direct care is you have to be ready to speak. You have to be able to speak about what you are offering, because depending on what community you're in, people may have no clue how this works, you
Correct.
know? So you have to be able to talk about it in a way that really allows them to see the value. And a lot of times, that if you have staff, if you're not doing it on your own and you are relying on someone else to answer the phone, you may know the answers, you may know the right things to say, but they may not. So realize you have to train your staff to be able to also sell what you are offering, because if they're not saying it in a way that is, highlighting the positives, then that could turn away potential patients. So listen to how your staff is talking to the caller and see how they're answering those questions, and definitely coach them on how to do it in a way that's effective.
Excellent advice. I had to do the same. I wrote the script and I educated my medical assistant how to answer questions.
Yeah.
And it takes some time. So don't expect
Yes.
they will be so clear on the things that you do just because they
Yes.
work with you. You have to make sure that they answer it appropriately, because the questions from the patients are, as you said, almost the same. And
Yeah.
having them on the website does not mean that people will go and read on the website. So
No.
they would rather call and ask questions. That's a
Yes.
more I think that's a more personal way to do business as
Yes.
well. Now, you are one of the members of the Direct Specialty Care Alliance from the
Yes.
get-go. We
Yes.
do appreciate your support greatly, as you probably know. But my question to you is, why did you choose to become a member?
Oh man, I was so excited when um I first heard that you were starting this organization, and I chose to I chose to join because you have to be in the room with like-minded people. This is not the physical room, but now it's the online room, right? We're connected through the internet, whether it's through
Correct.
Facebook, emails, videos on YouTube. But you need support when you're starting this journey. And it's really important to find other physicians who are making this transition or have made it already, to look and to collaborate with and to ask questions and to get support from, because depending on where you are, it can be pretty isolating. I mean, in my
Correct.
community, when I made this transition, many of my colleagues were very confused and perplexed. And some of them were like, oh, this is a bad idea.
I know, I
They were
know.
like, that's not gonna work, you know? This is gonna it's gonna be a challenge for you because I don't think people are ready for that here. I was told that by multiple people. And so when you're doing something like this that involves so much uncertainty and risk, you need to hear positive messages. You need to see real life examples of what's possible. So when you are in a group where you have other physicians all over the country who are doing the same things, are going and facing the same challenges and having the same tough conversations and answering the same questions, you can learn from those people, those individuals, and then you eventually can teach others coming in after you. And I think it just makes the whole journey even more fulfilling because now you have the opportunity to relate to your colleagues on a whole nother level. That has been really fun. It's been really fun doing this because of the camaraderie. So I've got my comrades online and my comrades in real life in my community.
I
So
think that
that's
that's
what I would say.
this message is very powerful for people that are not yet part of the alliance. We want to be there to support each other. We want
Mm-hmm.
to remove that feeling of being alone, being the pariah of the system. We are here
Yeah.
to do great things. We have value. People come to us because of our value. We don't have anybody to refer us patients. The patients come to us. So
They find us.
that's true. And the other thing that it's important for people that are not yet part of the alliance, but they still do direct care, is that we come together, we promote each other, we tell patients, if I have a patient from your state looking for or needing an endocrinologist, then I know where to send the patient. We are all
Yeah.
on a map. We are all visible. Patients can find us. Other physicians can find us. So we are not like spread out around the country, but nobody knows about us. So it's
Yeah.
a way to promote us to the patients because they are the primary beneficiary of the work that we do. It's also that community feeling that
Mm-hmm.
you
Yeah.
doing the work that you do in endocrinology, you're not alone. There are so many other
Yeah.
endocrinologists like you. You can pick up the phone, you can find one of them, and if you have a challenging situation, you can ask them, what can I do to solve this
Yeah.
issue? So I think that that idea to come together as a community, it's extremely powerful. And the message that you
Agreed.
send out, the message that you send out, that you take it to the next level, you know what you're doing, and now you can educate someone that basically have no idea where to start. That's extremely
Yeah.
valuable. And finding
Absolutely.
finding those resources, and not looking in 20 directions, spending a year. Finding those resources put together is also valuable in terms of time,
Absolutely.
effort, and it's going to pay off so
Yes.
quickly. So we are approaching the end, and I'm so grateful that you gave us the time. What is your message for your patients, for the patients, about direct care? And then we have to conclude with a message for the
Yeah.
physicians that are on the fence to try direct care, or they are just in the beginning of their journey.
We all, at some point or another, we are all patients. And so I think we all want the same thing. We want to be listened to. We want the attention of the person we're seeking that care from. We want the time. We want to feel when we leave like our questions were answered, or at least they were considered, even if there's no answer. And we want to feel that there's this human connection with the person who we've come to in our situation of vulnerability. And so direct care, I feel once patients access direct care and experience the difference, it's hard to go back. I think you get that personal time, that individualized care that you really cannot put a dollar figure on. And depending on what health challenges you're facing, you have to consider what's going to be more cost effective. Is it going to be the conventional system for me where I may not have the time necessary to really get to the bottom of what's going on and what the problem is? Am I going to have to do more and more tests that are costly? Am I going to have to be in and out of the emergency room because no one has the time to actually sit and investigate what's going on? And what about the bills that I don't know about before I receive the service that come in the mail? They add up. You have to look at that and compare it to, you know, seeking out someone who is an expert and has the time to devote to really delving into the issues and will tell you before they even see you how much they will charge you. It's there for you. Many of us have our pricing on our website. Mine is always right there and I update it anytime it changes. So you know, and you can budget and plan towards your health care. And then we have the added perks of we will negotiate cash rates for our patients so that you can save on what you might otherwise be spending when you use insurance. No question, everyone needs insurance for catastrophic events,
Right.
surgery, hospitalization. But that does not guarantee you quality, health care, especially preventative care in the outpatient setting. So you really have to sit and think about what your needs are. Are they being met in the conventional system? And what is it costing you each year? And then look at, is there another option for you? Could direct care give you what's missing? And could it be as cost effective and often more cost effective, I would say, than what you might get in the conventional system when you consider all these different factors? So, for patients, I think it's really about looking at the pros and cons of each and looking at your individual health needs and making that determination. It's a very personal decision, but I think when you consider all the information that's available now and organizations like the DSC Alliance that will give you this information for you to really make an informed decision. I think it's a beautiful thing that you have these options now.
Correct. It's all about
Nowadays.
the options. People that have insurance offers through their employers, they don't even realize that they have another option. And the problem is access. When you need it the most, when you are
Yeah,
in that need, how are you going to access a specialist? Because all that you're offered
yes,
through your insurance is someone that you have no control, that you have no
no.
options, and they will see you in 6 months in my situation.
And you don't have a choice in the matter.
What is the message that you have for physicians?
Physicians considering direct care, I say it's a no-brainer, but you really have to know yourself. You have to know how you operate, and you have to be very real with yourself about why you're making the transition, and be sure that you're not running away from something that you may be faced with again in a whole different way. But I think most physicians who are, at least who I've talked to, considering direct care, really have powerful reasons why. And many of the time, one of the items on the list is the patient, really trying to serve our patients in a more effective way and in a more personal way. And I think if if you are really grounded in why you are doing it, um, and you've thought about the alternatives, and they don't look very good to you, um, why not? What I tell people is you can always go and get another job if you need to. You can always go back.
That's
If
true.
you try and you say this isn't working, this isn't for me, you can always find a job. But the alternative of never taking the chance and allowing yourself to see what's possible, and truly having the autonomy, and being the person driving the ship, as you deliver care to your patients, I think that's just, it's worth any amount of risk to just see, how can I make this work? How can I make this serve my patients better, as well as myself, because I deserve to be happy and fulfilled in my role as a physician. And I think if there are doubts, hey, that's normal. They're supposed to be there. Just know that failure, um, should not be the reason. The fear of it should not be the reason that you don't make that transition, because the worst case scenario is you don't make it successful and you get another job. But the alternative of continuing to do the same thing that deep down you don't feel is right for you or your patients, or you don't feel fulfilled, and even kind of losing some of your passion, if not all of it, or having thoughts about walking away from medicine altogether. That alternative is, I just don't think it's a good one, because then it's like you feel, then you're trapped. Where do you go next? But if you make the leap and you try direct care and you give it your all and it's not for you, you can always go back. You can always do other things. And these days, with all the resources available, like what's offered through the DSC Alliance and DPC Alliance and all these groups, you can make it happen, and you can make it happen in a relatively short time frame. It all depends on what you're willing to try, how much you're willing to put yourself out there, network, learn from others, pull on resources available to you, and you can do it. We've done much harder things to even become
Correct.
physicians. We've done pretty hard things. So if we can learn, acid base and things like that, and come out and pass
Sane.
boards, you know yeah, and still have our sanity, we can open up a direct care practice and figure it out. So I just encourage people to, if they're really thinking about it, take a chance on themselves, trust themselves, get the resources necessary to do it with a plan. I'm not saying just jump out there with no plan.
No.
Make your plan, based on your own situation, whether you have, family to take care of, or parents, who you're a caregiver for. Make your plan. You have to consider the finances and everything, but know that you can do it no matter, what it looks like. You can make it work. And in the end, it will be worthwhile, because you would have fulfilled, a promise to yourself, and shown yourself that you can trust yourself and make sound decisions. And then you would have really, fulfilled something for your patients that's so valuable, because people truly appreciate this idea of, wow, you're doing this just so I can have more time with you, so that you can pay more attention to me. That's priceless. People really truly appreciate it. So that's what I would say to those who are on the fence. Just come on over. The
Good.
grass is greener on this side.
That's true. That's true. This is a very empowering message. When I started my journey, I thought I'm the only one that was empowering people, but hearing all the specialists that I interview sending out the same message of happiness, independence, autonomy, doing the right thing for them, but also for the patients. Let's don't forget that if we are not well, our patients will not be better. This
Correct.
is going to be reflected on the way that we treat our patients. Of course, the patients remain our primary goal, but we have to be there. We have to put the oxygen mask on us before we give them what they
First,
need.
yes.
So I would like to take the opportunity to say once again, thank you for giving us the time. Thank you for sharing your journey, your advice, and I hope I will see you back in the future in this webinar. And I wish you all the success in the world.
Thank you so much. It was an absolute pleasure. And thank you for doing this and being a trailblazer. You're a trailblazer because being able to rally people from all their little silos all over the country to come together into a movement. You know, as specialists, we had to kind of figure out, and we're still figuring out, how do we fit into this direct care puzzle, right? Because it was primarily primary care,
Correct.
and so now this is new territory. So thank you for being a trailblazer and really pulling people together and showing other specialists what's possible for them.